So, feeding children can already be challenging, but when you add ALL treatments and hospital stays into the picture, nutrition becomes even more complicated. Parents often wonder if they should push food, what to do, what their children refuse even their favorite meals, or how to cope when feeding tubes are needed. These are very real struggles for families, and that's why we chose to focus today's session on this really important topic. And that's why we're very grateful to be joined today, but not one, but two oncology dietitians to help us with this important topic. So I welcome today Hannah Hasby. She's a clinical dietitian and board certified specialist with hematologic malignancies, and she's 2017. She has keep her and focus her job on children with cancer at MSK, supporting patients with blood cancer, neurological tumors, and those undergoing cellular transplant therapies. We're especially grateful to have her expertise today, given her direct work with these pediatric oncology patients. And I also welcome Peter Adentori. He's an advanced practice clinical dietitian with certifications in oncology nutrition and nutrition support. He has worked extensively with adults undergoing bone marrow transplantation and brings deep expertise in managing the complex nutrition needs of patients with blood cancers. So thank you both to both of you. We're so honored to have you guide this important conversation, and I leave the room to you.
Thanks so much, Mary Lou, for having us, and thank you all for being here. Really excited to chat for a little bit. So let me just go back to my first slide here, and then I'll share my screen. Okay. Everyone can see that okay?
Yeah, perfect.
Yeah. Okay, great. All right. So, as Mary Lou said, my name is Peter, and I'm going to kick us off here. And my colleague and good friend Hannah will take over from me in a little bit. So please, as Mary Lou said, we have both been working with patients with blood cancer across the age spectrum for a number of years, so we can really answer whatever questions you might have. And so please feel free to, don't be shy. We are both very excited to hear what questions are on your minds.
We love a chat, Peter and I.
Yeah, we love it.
We love a
So,
chat.
we are certainly not as formal as it may seem. So certainly
No,
feel free to, chime in as you have questions and pop them in the chat, and we'll get to them during the Q&A.
totally.
So as we go through this today, we wanted to talk a little bit about kind of putting together a dietary pattern, what that might look like, highlight a little bit about nutrition and its role during cancer treatment, and then talk a little bit about dietary patterns for risk reduction and survivorship with cancer, knowing that, of course, while we're focusing on pediatric ALL, we know that there's also a risk for further cancer or recurrence of cancer. So there's some things with our diet and movement and such that we can do to reduce our risk for that happening. And then we'll sort of wrap it all up into key takeaways. So first, diving into constructing a dietary pattern. So the first thing that comes up when we think about constructing a dietary pattern is macronutrient balance. And the question Hannah and I always get while we're practicing is, how many carbs should I have? How much protein should I have? Should I be having this type of fat or that type of fat? We know that seed oils are very big in the world right now, and their interest in, what types of fat sources are best for us or our children. And really, the reality here is that each of these nutrients plays an extremely important role in the way that our body functions and really giving us fuel to move through cancer treatment well. And we particularly like to highlight protein as something that really helps with recovery during any type of treatment, chemotherapy, radiation, surgery, whatever it is that people undergo. Protein tends to be something that's really important for so many body functions. So we always like to emphasize with our patients, what types of protein sources are working. And we know that that may change day to day. And so, one of my favorite things to do is just to sit with patients and brainstorm and really understand what might be working for them in that moment and really what hasn't been working and where we can kind of move forward from there. The next step, there's a lot of interest in plant-based diets in general, and this comes from adults more than pediatrics necessarily, but I think some of the knowledge and some of the interest is also blended its way down into our younger patients as well. And so really what I try to work on with patients across the spectrum is, where we can incorporate plant-based foods, there's a lot of value to that. So that being fruits, vegetables, nuts, seeds, whole grains, these things really hold a lot of value for us nutritionally. And so when folks have a diet that's really not including many of those foods, I try as best I can to determine where there are opportunities to introduce those foods in small quantities and sort of build from there. And it's also important to recognize that this is not an all or nothing thing. So people don't have to be a full omnivore or a full vegan. And there's sort of this wide spectrum in between. And so small changes, sort of incorporating more plant-based foods can be beneficial for not just oncology risk, but also many other chronic diseases later in life. Similarly, there's a system called NOVA, which talks about food processing. And again, this has been a lot in the popular media about ultra-processed foods and how they may have a role in um, many different disease conditions. And we know that's the case. However, as you can imagine, having only unprocessed or minimally processed foods is nearly impossible, especially because we have processed culinary ingredients like the oils and salt and butter and things that really make cooking possible. And so what's important here is that we really think about the balance of our diet and really how these foods all work together and really meeting our nutritional needs. And we recognize as well that, we don't only eat food to nourish ourselves, right? Food has such a powerful role in our lives, whether that's through celebration or through enjoying the taste of the food. And we especially know in our young children that they may be having a diet that's really high in ultra processed or processed foods because those are the foods that feel good to them at that point. And that's absolutely okay, right? A nourished child or a nourished person is much better than someone that's trying to eat healthfully and really struggling with that. So we really try to meet folks where they are and promote healthful nutrition as best we can. And there are just times, certainly during treatment, where that's much less feasible. And so putting that all together, and you'll see this slide again at the end, this is really the way I think Hannah and I both put our brains together about really how we advise our patients. We recognize it's very individualized. And so the dietary pattern that works for each person is the one that works for them, right? No two patients are the same. There's different strategies that work for each person. And when you know something is really working, it's something that's really balanced. It involves being gentle with ourselves and our our children as well if you're really stressed as the parent or caregiver, something that can be really consistent, so it's not sort of like a trend or a fad that can be followed for like a week or two and then given up on, but something that can really stick. And it's personalized, right? There's a way to nourish ourselves with foods that are culturally responsive to what is something we've been having throughout our whole life. And we recognize as well this wonderful wheel that Hannah actually found is different components of what we call lifestyle medicine. So that being nutrition, physical activity, stress management, relationship building, sleep, and risk prevention. All of these things can really have a role in improving our health. And so recognizing that dietary choices are just one of those slices of this pie that are really valuable opportunities for us to engage in lifestyle behaviors that are really helping our overall health. And the thing I tell almost all of my patients is just to take it one meal at a time. Every day going through treatment is very challenging in different ways. So rather than sort of allowing the beginning of the day to influence how the rest of the day goes, I always tell folks, let's just take it one meal at a time. And if you're not feeling great and it's, traditional breakfast time, let's just hold on for a little bit and see how we feel in a little bit. And we only have to have a small amount. And Hannah and I will go into that in a little bit more detail. So Hannah, I'm going to pass it over to you for the next couple.
You're going to still be my slide person though, right?
Yes.
Thank goodness. Okay, so yes, everything that Peter has said, I think we both really align with. I will say, working in oncology and also just being in the world of dietetics, that every dietitian kind of can approach certain things a little bit specifically. I also teach, and I often tell my students that if a different person taught this class, they would likely focus on different things and talk about different things and kind of have a different relationship to how they're speaking about food. One of the lovely things about nutrition and food in general is that everyone eats for the most part. So everyone kind of has some buy-in over what they're putting into their body. And it's a little bit different of a specialty than, say, pharmacy or something else. It's a little bit more highly specialized. So there's pros and cons to that. But I think for me, and I think for Peter as well, it's nice to kind of have that alignment in how we talk about these things. That being said, you could do many, many hours of talks about nutrition during cancer treatment. I think, we kind of wanted to just distill it into a couple of bite-sized things to just take away. If you want to go to the next slide, Peter. Great. So I think this is a good kind of way to think about goals for nutrition during cancer treatment. Obviously, those goals can change. The actual minutia of the calories that someone needs or the fluid or anything else should be kind of discussed with the dietitian on your healthcare team or on your child's healthcare team. But I think the kind of big things to focus on, and especially, this applies both to pediatric patients and to adult patients as well, is that our goal is to minimize weight loss as much as we can. There are certain diagnoses wherein moderate controlled weight loss is not considered a problem, such as breast cancer, but we're obviously not talking about that here. We're talking about ALL, and we're thinking about some of these other diagnoses that we don't really want to see weight loss occur. In pediatrics specifically, a lot of times my goal is to just kind of help children maintain their growth curve during the course of their treatment, recognizing that there are going to be periods of time where their weight might fluctuate. They might have higher weight gain at one period of time, lower weight gain another period of time. The interesting thing about children as well is that sometimes you don't actually see changes in their weight so much as you see changes in their stature. So you might know that a child is being adequately nourished because they are getting taller, but they might not necessarily be getting larger, but they might just be getting taller. So there's, a couple kind of more specific things for pediatrics, but I think broadly speaking, minimizing weight loss is preferred. Peter and I can definitely speak a lot about practicing food safety. Specifically, we have focused on that together in our careers. And, I think there's been a lot of misinformation over the course of the years about what constitutes food safety during cancer treatment. We're going to get into what that looks like, but I will have patients who will sometimes say, my oncologist or my nurse or someone else said that I couldn't have fresh fruits or vegetables when I'm going through chemotherapy. And that is such a hard thing to hear, because obviously you want patients to eat fruits and vegetables if they can. And also, having that limitation is really stressful for parents, because a lot of times kids really just want a fresh strawberry. I don't know what it is about strawberries. I love them, so I get it. But we do a lot of education here, and also here being where I work, and also just as dietitians in general, about, it's not necessarily about the foods themselves, it's more about the way that you're handling them, which we will talk a little bit more about. Symptom management, which is very individualized. You could certainly have some good blanket recommendations in your back pocket for things that may work, but I find that getting to kind of know patients and getting to know what makes them tick food wise can really be helpful in terms of navigating their symptoms. And then, to my earlier point about how Peter and I are fairly aligned in terms of how we practice, I think one of the big things is just protecting someone's relationship with food and with their body. I'm very mindful of the fact that I have patients that could be anywhere from an infant all the way to a teenage patient or a 20-year-old patient, or so on and so forth. And those are all really critical periods where you're not only navigating such a, massive life change with so many things that come with it, but also just navigating adolescence and navigating your body changing and all of these things. So trying to not talk about food in a way that can instill a tough relationship down the road is really important. Peter, am I missing anything? Do you
No,
feel?
it was great.
Okay. Again, we're a big chatter, so I feel like if I were missing anything, Peter would jump right in. So to our first point about minimizing weight loss, a lot of this can occur due to the symptoms that you see here. I find that for kids, a big one is just no appetite, which sometimes can be hard to kind of parse through what that means. Because it could be no appetite due to a taste change, it could be no appetite due to nausea, it could be no appetite due to food preference and availability. So there, sometimes part of my interview with a patient with their parents would be trying to suss out what that means. Taste changes are huge. I talk about taste a lot with my patients, especially for those that I see that undergo stem cell transplants. They have a lot of taste changes that occur with that process. I always will talk to patients. I was doing this today actually about trying to find a category of taste that tastes a little bit normal. Anecdotally speaking, a lot of times it's salty or vinegary or sour things really kind of come through for patients that are having taste changes. It can also be as simple as expectation setting that things are not going to taste the same, and perhaps sticking with plain foods or sticking with things that are not as heavily seasoned because they're not going to taste how you expect them to anyway can be helpful. And that's really where kind of getting to know the patient and their preference and kind of their history. Gut symptoms, that could be anything from nausea, as I mentioned, abdominal distension, gas, pain, cramping. There's so many different things that can happen along the GI tract when it comes to chemotherapy and other treatment modalities. And so many times these are, you can kind of pinpoint them to the chemotherapy or to the medication or other things, but certain foods may or may not make them worse. So kind of having an understanding of, are you someone that tolerates dairy? Were you tolerating dairy before you were getting chemotherapy? Are you drinking a milkshake and getting chemotherapy at the same time? Perhaps, yes, the chemo is what's causing your diarrhea, but also it could be you didn't tolerate this before and now you're having a milkshake that might not make you feel any better. Fatigue and low energy can definitely be a large obstacle. I see this a lot also too in our older patients, just especially if they are their own primary caregiver or if they are the primary caregiver in their house. If they are fatigued, if they don't have energy, the thought of cooking or preparing meals can be really strenuous. And then stress and mental health, and especially for kids, being taken out of their own environment. They're not eating with their siblings, they're not eating with their friends at school. There's a lot of things that can impact how and why they want to eat, and acknowledging that and trying to kind of hold space for that is really important. You will hear every dietitian probably ever talk about small frequent meals. It was one of the first things I learned as a dietitian in school. And it's annoying because it's very it's repeated so often, but it is actually true. I will caveat this to say that sometimes I talk to patients and I ask them if that's their normal eating behavior, because if they are eating 3 meals a day and that works for them, I'm not going to tell them to eat 6 small meals and break it up. But that being said, if they're finding that they are getting full early, or if they are having just kind of some exhaustion of eating or other things, breaking up their meals into smaller sections can be really helpful. I will oftentimes tell patients to set a timer and just kind of try to eat something every 2 or 3 hours, just kind of almost, and I frame it as important as taking a medication. I will say, okay, if you're supposed to be taking your 10 a.m. meds, your 2 p.m. meds, your 6 p.m. meds, whatever it is, we can try to structure food so that even if you're not hungry, you're just reminding yourself to take a couple bites at that time. And over time, you can hopefully kind of reset your hunger and satiety and how you feel. Anytime we have patients eat, if they're not eating a lot, especially, we're going to go for higher calorie, higher protein meals. As Peter said before, protein is definitely a nutrient of concern, especially for patients undergoing treatment. But, this is kind of where we can have, a little bit of kind of freedom to say, add a tablespoon of oil that's 100 calories, add a butter to your rice, to your potato, to whatever else, add cream, do things that can just make whatever you're having as calorically dense as possible. The freedom with that also comes with kind of reframing healthfulness, I think, because especially if you have someone who has a very, very dietary pattern, having to kind of go through the mental load of understanding that right now, if you're eating all of these foods that are not thought to be healthful foods per se, it can kind of have a little bit of a taxing toll. But, as Peter said before, your focus is really just on nourishing yourself. And so if that comes from things that you would not normally eat, I think it is just as important to frame them as helpful in that time. Being gentle. There are a lot of times also too, especially when it comes to talking to parents, trying to kind of remind them that they're doing the best that they can do, that these are tough circumstances, that they are not um, ones that, anyone should have to navigate. And so being a parent who's dealing with a 5-year-old who's already a picky eater, undergoing chemo, and, saying, I can only get them to eat Chick-fil-A and that's it, that is okay. Being gentle is, I think, really important. And then if possible, this helps for a lot of different things. It's very annoying that physical exercise does make you feel better, but even when you're undergoing treatment, we find that it helps with even just moving your bowels and constipation. It kind of helps just keep fluid from accumulating in your extremities. It just helps patients feel overall better. It can help with stimulating their appetite a little bit. So if they can, even if they're just getting from their bed to their chair, we encourage movement as kind of part of a holistic approach as well. I think that's all I got. For the food safety piece, as I mentioned before, the kind of focus is more on food handling rather than foods themselves. The caveat to that being, and I always make this joke with my older patients, is that I would love it if when you're getting chemotherapy, you don't get sushi from a gas station. That is like my number one joke that I always like to make, because no one probably should, but especially during this period, I'm like, please don't. Treatment can impact your immune system. It could make the cells that you have in your body less available to fight infection. And so something that might not impact someone who's intact, not immunocompromised, but either way, might impact someone whose immune system has kind of been suppressed due to treatment. And, that could be as simple as someone cut a vegetable on their cutting board and then touched a piece of chicken and didn't properly wash their hands, and then they touched the vegetable again, and that is not the vegetable's fault, but it's in the handling of the food. And so that would likely impact someone who is in an immunocompromised state a lot more significantly. Tips that we give for this is to make sure that any proteins are cooked thoroughly. So meats are cooked to an appropriate internal temperature. For that, we can recommend that patients get a meat thermometer if they want to be very specific about the temperature, which can be helpful. Chilling things, not defrosting things on the counter, but defrosting them in the fridge so that they're not going through various zones of cold, hot, warm, cold, which is where bacteria loves to grow. Separating cutting boards, as I mentioned before, not having that cross-contamination, making sure that if, let's say, I will often talk about this with patients and their parents, but if you have a helpful family member who's really excited to be able to kind of show you an act of love by cooking for you, make sure that you also are giving them this instruction as well. Make sure they're washing their hands really well, they're cleaning their utensils, they're doing everything that they can to kind of assist with keeping exposure to foodborne illnesses minimal. And then a good rule of thumb is that we say no leftovers past the 48-hour mark. So not after 2 days, at least in the fridge. You can keep things in the freezer for a little longer, but nothing in the fridge after 2 days. And definitely don't heat or reheat and cool and freeze and do all those things to stuff that better to just throw it out.
Awesome. Thanks, Hannah. I'm
Yeah,
going
of
to take
course.
over for a couple slides here. So just going to talk a little bit about symptom management. And as with all these other topics, we could literally spend hours talking about this. So what we've tried to do here is really categorize these symptoms into 3 categories here, and give some tips, right? The reality is something that I'll say again in a few slides, is that symptoms are personal to each patient and the child's experience itself. What I think we've realized in all the years that we've been practicing is that we can get really good at predicting when symptoms might happen, but then there are going to be children or adults or whomever is getting treatment that will totally surprise us and they'll get no symptoms at all. And also, nausea looks different in every single person's body, the way people manage it, maybe you'll deal with it, etc. So these things are so personalized to the patient and also how they manage this. So starting off with symptoms for when it is hard to eat enough food. So as Hannah said, that can be due to low or appetite or no appetite. It can be due to feeling really full really quickly, due to your stomach not emptying as quickly as it would usually, and then some mouth and throat pain that might make actual tolerance of food a little bit more challenging. And so for low or no appetite, we like to say trying to eat around the clock, so making sure that not too many hours go by without any food. I usually give my patients the threshold of about 3 to 4 hours to make sure that they don't have that gap where there's nothing going in at all. And again, that's not to say they have to have a meal every 3 to 4 hours. It's to say that there should be something nourishing their body every few hours just to kind of keep that metabolism supported and keep their energy levels supported as well, knowing how taxing it is for cancer treatment to be working on them. It's also sometimes helpful to separate liquids and solids from one another because both of those things do fill up the stomach. So if someone is hydrating and also eating, we try to sort of separate those things as best as possible to give the body the chance to have as many foods as they can. Um, Also recognizing that preparation of food is challenging, so getting easily prepared foods both for the caregiver and for the patient themselves, it can be really helpful. And engaging with light movement, as Hannah also mentioned, can kind of help stimulate a little bit of appetite. Now, if folks are feeling full quickly, we like to have people lean on higher calorie, higher protein foods to really make sure that they're getting the most nutrition as possible in each of those bites and sips. So that way it's not like you're, wasting some of that appetite or some of that space in the stomach on really low calorie foods. It's harder to nourish on those foods. You need a lot of volume. Also listening to someone's body. The last thing I want is for someone to force more food in and then vomit as a result, right? Especially when there's nausea. So that can definitely affect further eating. So really listening to those body cues, and if someone's feeling really uncomfortably full, not to push it. Making sure that convenience foods are available because those foods, these appetites can come and go. So if there's something easily accessible, that might be the thing that a child or a patient will reach for in order to be able to get some nutrition in. And also, this is where liquids can be really helpful. So those higher protein, higher calorie liquids, smoothies, milkshakes, these kinds of things can make a big difference because they can pack some nutrition in. And also, they do tend to empty through the stomach pretty easily. And so they'll be the ones that'll be much less likely to fill that stomach up and make it feel really full. And then with mouth and throat pain, this can be from a variety of reasons. I always tell patients this is time to kind of try different food temperatures, food textures. Usually people don't love things that are very hot, but some people tell me cold is bad. Some people tell me I would prefer everything to be room temp. It really varies. Some people tell me they want just liquids or they want just pureed types foods, and some people are okay kind of chewing and having some softer foods. Typically things that are really highly flavored or acidic can have some discomfort, especially if there's open sores in the mouth or in the throat. So those softer and more moist foods tend to be beneficial for patients in this case. So now when you're afraid or the child is afraid to eat anything, right? No one likes to feel nauseous or vomit. So a lot of the time, the foods that I tell people to lean on are things that are more bland. My favorite advice to give is to avoid their favorite food because unfortunately we associate that favorite food with that period of nausea. So I've heard so many patients over the years that tell me they can't have this, family recipe that they've been having for a while because they associate it with that time they were nauseous. So I always tell them, lean on the foods that you don't care. Like you can have that oatmeal and realize you don't really care if you ever eat oatmeal again after that. It's totally okay, right? We still want you to nourish yourself, but definitely don't want you to ruin, any of the foods that are really important to you, either, personally, culturally, or just how it feels for you. This also goes for stronger smells or flavors. Some things we don't really know what the trigger is for nausea, and maybe the food itself is fine, but then someone gets the smell of the food as it comes in, and all of a sudden it's awful, right? And they can't even think about eating. And I also think it's important to make sure that patients are well supported by medication. So many of the anti-nausea medications take about 30 minutes to go into effect. And so as a result, I usually make sure that people are sort of preloading themselves with an anti-nausea medication, even if they don't feel nauseous at that time, to kind of prevent any nausea from coming up at the time of the meal, because then it really sets them back if then they have to wait another 30 minutes before they can try a bite of food. Now, we recognize also that, as Hannah said, loose stools are kind of a reality of any chemotherapy or really a lot of cancer treatments. And so we always like to make sure from a nutrition perspective that patients are hydrating well because we lose a lot of fluid through that, looser stool. And then also recognize less important for kids, but foods that are really high in fat and coffee and also lactose can be triggers for further diarrhea depending on the source of the diarrhea. And so usually I don't have to worry about my kiddos having too much coffee. That's for adults, that's the case, right? Myself included. And so with fat sources and lactose, that's important too, to kind of have that balance of good nutrition, but not sort of make the diarrhea any worse.
One time I did have a 2-year-old that drank coffee. Like
Interesting.
she had her morning coffee. And
Okay,
I was like, okay.
sure.
Like a
How
small
the
little
caffeine
amount.
might have, yeah, the caffeine might have not been so lovely for her, but alas.
Depends on the kid.
Yeah. And then the last piece there, the classic knowledge of the brat diet is something that does still work. So having applesauce, bananas, oatmeal, potatoes, rice, things like that that are high in soluble fibers can really help to make those stools a little bit more formed and a little bit more solid and normal for the person. And then lastly, with gas and bloating, again, something that is so individual. One of the things I do like to recommend is to limit straw use when this is the issue, because when we're taking in sips of, whatever it is through a straw, you're actually ingesting some air too. So if there's already sort of a bloated belly feeling, having additional air in there can make it a little bit worse. Similar with, high carbonated beverages like a soda or a seltzer, things like that. Those things can also have those bubbles that just make the bloating worse. And I would just say kind of eating slowly and chewing small pieces as to not enter a lot more air in there can help. And then really just talking to healthcare providers to figure out the source of the bloating, right? There's no reason that we have to feel this uncomfortable indefinitely. There's plenty of medications and treatments that can happen to help that bloating get eased. Um, and also, I would say this is another area where taking that little walk can help too. Some people that have bloating chronically, just a little walk after eating can really just help ease that belly and kind of get the gas to kind of go where it needs to go. And then lastly, for really when eating is not enjoyable, and I can't say that I have a lot of patients that tell me they love when it's time to eat during their cancer treatment, right? But there are certain things we can do to kind of make it a little bit more helpful to, enjoy that eating process. So for taste changes, really if someone has access to a dietitian, talking through that, right? Hannah gave some strategies earlier, but those taste changes can be really difficult to manage and they are really tricky. And so for each person, I usually like to understand what is working, what's not working, if there are certain foods or beverages that are the absolute worst right now to kind of get that picture. I always give the story of someone telling me they would be avoiding chicken and at the hospital we used to have a, chicken that had tomato sauce on it, and that was the only one they were ordering. And so then they told me, yeah, I also can't have pizza. And I was like, wait, those both have tomato and tomato sauce, and it's pretty saucy. And so we actually gave them just plain chicken without the sauce, and they were able to taste it fine. And then it had another source of protein added back in. So these are the things that come up where you can sort of reason with someone as to what's happening and if there's a pattern that maybe they don't see, but kind of a new set of eyes can understand what that pattern is and help redirect a bit. Um, and again, something I always mention to my patients is that their taste palette is so different than my taste palette. So things that may not taste, like anything, they may tell me tastes like cardboard. I may take a spoonful of it and be like, whoa, that's really salty, or whoa, that's too much, seasoning in there. But sometimes we just have to kind of like amp up the amount of seasoning to break through those taste buds. And that can really make a big difference. Similarly, dry mouth can be really connected to taste. So if anybody's had a cold and your nose is really clogged up and you get that dry mouth, again, there's not really any food that tastes great at that point. Sometimes liquids are okay, but usually foods with sauces and liquids can sometimes help offset that dry mouth, as well as things like hard candies or mints or frozen grapes or ice, just to kind of keep that mouth lubricated, and practicing good oral hygiene to make sure that that's not continuing to be a problem for dental caries and things like that on top of the the dryness being an issue. And then lastly, with sadness and fear, and of course, this is a huge part of cancer treatment, is managing all the emotions that go along with it. So really, I encourage patients and their loved ones, and thankfully, we tend to have really wonderful teams surrounding patients, especially pediatric patients going through treatment, but really having the space to talk through things that are going on, right? What is the source of stress right now? How are folks feeling? Especially in kids. I love the child life therapists for this to really help kids stay kids as best they can. That's always fun. And whenever I'm able to join Hannah for an event where we're going to do some fun activity that has nothing to do with nutrition, I love doing those things because you really get to sort of see the kid light up in a way that you don't otherwise get to see very often, and it's really inspiring. And I also like to make sure that, this eating environment is as positive as possible. So if there's a piece of music or media or something that really induces some of that positivity, I like to help associate that with eating as well. So that way there's sort of a good environment around that eating. And it's not that, this is a task or sort of a chore that someone has to have. And then really just wrapping that up to say, again, the experiences are individualized. Advocacy is so important in this area, especially with kiddos. It's hard to really tell what they're feeling because they can't tell you they're nauseous. They can't tell you they have belly pain a lot of the time. They might just exhibit those symptoms. So I feel like whenever I've taken care of kids, usually when Hannah's not working, I take care of the kiddos. And at those points, um, I really feel like I've gotten good at like reading children's body language as a result to be like, oh, they probably have gas or they have constipation or something going on, because you can kind of just understand what's going on with the way their body is positioned or the way they're, presenting when you're looking through at them or talking with them a little bit. Again, that there's lots of medications and treatments there to kind of help treat these things. So I always try to make sure that people know they don't have to stay in that really uncomfortable space for longer than, they are in at that moment. And then, of course, taking it one day at a time, one meal at a time, and those small, frequent meals, high in calories and protein, are going to be our best friend. All right, so before I pass it back to Hannah, just to wrap up here, the point about protecting our relationship with food and body, I think this is extremely important, and it's really central to the way that both Hannah and I practice. Is we recognize that cancer treatment is an extremely interrupting period in our life, right? So we all, those of us that have not experienced cancer treatment, hope to stay that way, where we don't have to go through this individually. But we recognize that, there's lots of things where our eating pattern may change and our weight may change as a result, and to really hold space for how folks are feeling about that, whether that's weight gain, weight loss, maybe a fluctuation of the two. Um, loss of strength, these sorts of things can be really important just to be able to talk about. I also mentioned earlier that food is just one of the many tools for health. Unfortunately, people tend to fixate on food as something they can do. And so I always like to sort of take a step back as the dietitian and say, what else do we have? How are we feeling about sleep? How are we feeling about movement? How are we managing our stress? Like what other things are there? Because when someone tells me, oh, wait, you're right, I'm not eating well, but I am like getting out of bed and walking around every day. I've been sleeping really well. I really have been enjoying this TV show that I've been watching, and I feel like my stress is pretty low. Like, of course, this is not a child telling me all of these things, but kind of getting that from the parents, like they are fun, they're playing, they're doing these things. Like these are all things to celebrate, right? Especially when food is so challenging. And recognizing these symptoms won't last forever, right? These will break at some point, and I think that's an important piece too, because the really difficult parts don't have to be a forever thing. And that gentleness is so very important to really make sure that, we're not putting too much pressure on the food itself or the process of kind of healing ourselves throughout the cancer treatment. Um, and then before I pump it back to Hannah, we have some really, Hannah actually found this graphic too, but some different barriers to being able to eat adequately, and then some opportunities where we can intervene. And so, really this is just a nice summary slide for your resources of just things to think about. And a lot of this is captured in what we have here, but this is a really nice summary of sort of how this all comes together. Hannah, I'm going to pass it back to you.
Awesome. Okay, I recognize our timing, so I'm gonna take this sort of as quickly as I can without going too fast. But I will say that this is not my primary focus as a dietitian at my current practice. We have a really fantastic dietitian who focuses on our long-term follow-up patients, so patients that have gone through treatment, whether they're at MSK or elsewhere, and they come and are followed by their multidisciplinary survivorship team. So taking that with a grain of salt, some things that I do know to recommend, Peter, if you want to go to the next slide, are very similar to kind of, what Peter spoke about early on with just kind of thinking about the breakdown of your plate and kind of thinking about the breakdown of a dietary pattern. Basically, the goals are just to increase the amount of whole grains and legumes and fruits and vegetables and fluids such as water that one consumes, and decreasing ultra-processed foods, with the thought that those things tend to have a lot more sodium and added sugar and other things that have not been shown to be super beneficial in excess for health. Being mindful of how much sugar or red meat one consumes, and similarly with sugary drinks. This graphic from the World Cancer Research Fund is applicable to adults and for pediatric patients, but obviously for kids, you want to also think about, you're not going to be talking to a child about alcohol consumption, or you might not be talking to them about, some of the pieces here, but, just thinking about being physically active, these diets that are rich in whole grains and fruits and vegetables, trying to be mindful of fast food consumption, and like I said, trying to kind of do everything in a balance. Peter, do you want to jump to the next? We just kind of pulled this out too, just to say, if you really are looking for like a quick takeaway for kind of longer term survivorship things to focus on, it's really just including more plant-based foods, which is a boring dietitian thing to say, that when someone asks you for the best diet, it actually really is just everything in moderation and focusing on plants. And then doing daily movement, so things that feel good, involving others. For kids, that could be playing team sports at school, it could be running around with their friends, it could be playing with their siblings. As always, being gentle with yourself. It might take someone a really long time to be able to get back to any capacity of physical movement that feels right for them, and that's okay. And then limiting as much as possible things like red and processed meat or highly processed foods. As I said, they're high in sugar and salt and saturated fat. Sugar sweetened beverages, which does include juice. Sometimes for kids, we think, it comes from a fruit, so it's definitely a helpful option. But if possible, we always love to encourage having the whole fruit. And then supplements and vitamins would be really under the discretion of your medical team, and only when medically appropriate. So if someone is deficient in a specific nutrient or something else, that could potentially be an indication, but not something we blanket recommend. And then okay, and then we had some information on here from one of the previous talks that Peter has given about risk for development for adult cancer, and kind of just looking at diet and activity, and just thinking, Peter, I think you probably could speak to this a little bit more, but just there's a couple factors that kind of key into risk development, and these data are based on association, not causation. So it's not to say that if you do something or don't do something, you're going to develop this type of disease. Is that fair to say?
Yeah.
Yeah.
And then, yeah, just to wrap up, this is, the same slide I showed earlier, but I think is a really nice summary of sort of the things we've shared. This is such a personal thing, and I think it's why it's so complicated of how to distill all of nutrition during cancer treatment into and beyond into one talk, but we did the best that we could. And so this is sort of an approach that I think is really important, is just to be really balanced and gentle, and we are happy to hear whatever questions folks have on their minds. So let me just stop sharing. Okay.
Thank you. Yeah, I'll go back and share so we can get to the Q&A part. Alrighty. Okay, so yeah, thanks. That was really impressive. I think it was such clear, funny, easy to watch, easy to learn. So thank you a lot. And now we're ready to open up the space for your questions. Anyone can ask anything. You can use the chat, or you can raise your hand if you're up to that. If your questions feels a little bit individualized, I might reword it so many people can get that answer. And with that in mind, feel free to start sending your questions. Okay, we have one already. Feel free to unmute yourself. Yeah, go ahead. No, we cannot hear you. But you are unmuted, so maybe we can. No, not yet.
Not yet.
Oh, there we go.
Oh, you can now?
Yes.
No, yes.
Okay, good. Listen, my superpowers are not in electronics. I'm just going to put that out there. IT is not that. So my name's Chef Kim. I am the chef at the Ronald McDonald House in Southwestern Ontario, and this is kind of my everyday conversation. So the thought that you guys are, when I heard you guys were doing this, I was so excited to be able to be part of this, because these are the kids I feed every day. These are the kids that I spend time with. And I'm also, other than being a longtime chef, I'm also a mindful eating and meditation practitioner. So I'm going to give huge accolades and thank you, gratitude for mentioning the protecting your relationship with food, because that is not the conversation that everyone's having. I've had kids come back in tears that say, I was told not to worry about real food. I'm just supposed to have another can of Pediatric kind of thing, when yeah, if you can imagine. So it provides a huge amount of frustration for me. So one of the biggest challenges we have, and that we've recognized over the years, is the window of time between those kids and their taste buds change. They go from wanting something and then being totally excited about it, and a matter like 2 minutes later, they don't want it anymore, kind of thing. So we've worked very hard to have I have a team of chefs that work for me now. So we've worked very hard to prep all of those kind of common items like mashed potatoes and gravy. We have bacon strips. We have all those kind of things that help support the kids and release a bit of pressure off the parents. And then we vacuum seal them and have them in the freezer so the kids can grab them within, I think we have a 2-minute time frame on it. I was wondering if you guys have any experience or extra knowledge on those things that could continue to support.
I'll defer to Hannah for that one. Hannah, do you have any like go-tos that have worked?
Well, I just got so excited when I saw Ronald McDonald House, because we have a Ronald McDonald House near where
I
we are,
did
and I was
too.
like, oh my God, we love Ronald McDonald House.
Yes.
No, I mean, I think it sounds like everything you're doing is really wonderful. I feel like with kids, they can be so finicky. And I always joke with parents that if they find a food that works, usually the next day their child stops eating it. And so I really hope that the parent is a big fan of whatever food it is, because they end up eating the remainder of whatever it is.
Yeah.
So I think having like smaller things that are just kind of like have an array of options, just because they can be so back and forth, can be helpful. But I don't actually think it sounds like what you're doing is kind of like the best that you can do, given kids are kids.
And it's so interesting because we have parents who will go out and get their kids stuff and that to try and support. And I said, even like for a chef, for me not to be able to make something fast enough that can satiate that kid's palate is like the greatest challenge on the planet for me. So we tried to figure out how to solve these challenges. And we've had kids that have, and it's usually kind of nearing the end of their treatment. And at some point, I'm going to figure out how to measure all of this, but they all go through a space where they just crave something totally different, like butter shrimp. We had a kid with whitefish. We had another kid who just loved lamb. Like some of these kids have crazy, incredible cravings of just something they might have tasted before. And then they've kind of hooked on to that again. But again, just like you said, it's almost never something sweet, almost always something salty. 99% of them crave bacon. So we have that as a regular go-to. It's kind of an ongoing joke in the house. But as a further question, unless I'm taking anybody else's time, but if you were to create the greatest dietary plan that you could for one of these kids, what would those items look like? This is the challenge that I've given to our hospital and the dietitians that are supporting our kids at the hospital, because I said, you can create the greatest meal on paper and I can actually physically create it for a healing standpoint. So what would that look like to you?
Wow, that is a tough one. Ideally, it would be every single nutrient that they need, but this big. So that they could take it in a little turmeric shot. No, I think it would probably just be something that balances having a little protein with a little fiber and ideally some fat. Um, and that can look very different. I mean, you're a chef, I'm sure you can have a lot more creative ways to do that, but I think packing in the most punch for the smallest amount would really be it. Or something I find that kids do well with sometimes is drinking. So like if you can pack a lot of things into a smoothie or even a soup or something that is just liquid, because sometimes
Yep.
they tire of chewing. And so if you're able to just kind of give them the option of you can drink this and you can get a decent amount of what you need, those are the two things I think of that are actual real answers and not my fake first one.
Yeah, I
Cool.
would
But I
say the
think it's
same.
really cool that you can do that. Sorry, Peter, go ahead.
Yeah, no, I was gonna say the same thing. I think like liquids that are somewhat malleable, so like smoothie bags, things like that, where you could just like grab it, throw it in the blender, and get it into a kid's mouth like ASAP with
Yep.
some sort of flexibility, I think is helpful. Because one day they'll love strawberries, next day they're like, don't put me anywhere near a strawberry. So
No.
if you're limited by that, you're like, okay, fine. The other thing I would say about taste changes too is I think texture becomes really important. So maybe they don't really want a specific taste, but maybe they really would do, I'll eat anything as long as it's crunchy, or I'll eat anything as long as it's soft, or as long as it's a soup consistency. So I think like whenever I'm struggling with taste, I sort of am like, okay, let's go taste neutral and let's think about like, okay, what texture of food, especially when there's more of the like ARFID type, like avoidant restrictive of like certain textures or colors, like that can definitely ease its way in depending on the kid. So I think it's important to sort of have that as another tool in your toolbox of like, okay, if I don't want to like bang my head against the wall about taste, maybe I can kind of pull in some texture and that can really help get me to the finish line of what
Yeah.
works best.
Okay, I love that idea for them. It's interesting because, and it's fun because a lot of well, fun for me, because a lot of the kids won't necessarily listen to what their parents will say in suggestions. And the parents, of course, bend and want to give in and are providing like electric green slushies and things like that, because of course that guilt of my child has cancer, I want to give them whatever they want, their life is hard enough. But we do it a little bit different where we have like our green smoothies include watermelon juice, and because they don't like they love eating watermelon, and majority of them are need hydration, so then we add in cucumber to it and add all those kind of fun things, and not many of them often say no to me because we do it together. And a lot of them, I think
Yeah.
that's one of the biggest pieces in for parents, and that is including their kids in the creation of some of those things. And that's where they get some of the buy-in. That's where we tend to get the buy-in, when the kids are involved in it. And then we kind of work with oh no, I don't really like this. Okay, maybe we can add this. And then we usually kind of come to a consensus together on what it is they like and how it's going to help them out. So yeah, this has been awesome. Thank you so
Thank you.
much. I think it's so exciting. I would love to keep in contact with you guys to pick your brain. There's not conversations. Funny, I know your Ronald McDonald houses don't have the kind of conversations we have in Canada and don't run the same
Yeah.
way, but our dietitians and some of our doctors are not having the same conversations you guys are having. So the fact that you mentioned things like turmeric and your relationship with food, to me, is so exciting and so in alignment with what we're doing here in the house. So thank you.
Thank you.
Thank you a lot for bringing this amazing questions. I also got excited when I read your title, so thank you for joining and asking. I have one question that we received before the event, and they were wondering, like, normally in ALL, kids get treatment for a period of time, and then hopefully it get done. So what happens after that part when they're done with cancer, but they're still concerned of like gaining again the weight if they are lost, like recovering this part? So what happens after? What are the tips that they can do after treatment?
I think the kind of latter part of our talk kind of highlights some of the things that we will recommend if they're done with treatment and they're thinking towards their next steps. You know, I think working with a dietitian is really helpful because they might have long-term impacts to their eating that would really benefit from kind of one-on-one counseling. I think, you know, I had a parent once describe the kind of stage after treatment as stage 4, where every support system is kind of starting to peel back, but a lot of the problems still remain. So I think giving, you know, individualized support as much as possible, and also kind of acknowledging that these eating behaviors and other things that might not just turn back on instantaneously just because treatment's done, especially depending on the duration of the treatment and you know, how intensive that could have disrupted their relationship to food, and also, you know, all those other things. And so I think, you know, some of the things we talked about are helpful, but also just working with someone individually and kind of thinking about that just because treatment's done doesn't necessarily mean that we should be fully peeling back on support if we can. Peter, do you have anything to add to that?
Yeah, I would just also say like something I think is really important in the adolescent and young adult phase too, where some of these kids will sort of move through, is that sense of community, right? So being able to network and sort of have that connection with other either kids actively going through treatment or have recently finished treatment as well, that is so incredibly important. And it goes for my adult patients too, that they love that opportunity to just talk to someone that's been through it. And I always tell my patients, I hope I will never be able to relate to them on an individual level of what they're going through presently, but I can certainly help connect them with people that are going through it and kind of speak to some of the feelings and things that they have, whether it's the fatigue or pain or whatever it is. That community can be huge, especially when maybe they've already navigated some of these later stage eating effects or things like that, and they have strategies that really worked for them and they can learn from one another. And sometimes, as Chef Kim mentioned, sometimes they don't want to listen to their parent, but they'll listen to someone that's already been through it. And they also sometimes don't want to listen to their dietitian, as nice as we are. So sometimes just hearing it from another kid or another adolescent can be really helpful. So I would definitely encourage that whenever that's available to connect with those resources.
Thank you. Awesome. Another one that I thought, and I read on Instagram, I think, like on those days when families are away all day long from home, from long lab visits or hospital appointments, what are those like snacks ideas that you recommend that a mom or a dad or like a loved one just put in their bags for later on? What are those snacks?
Yeah, I think Hannah sort of alluded to it earlier that like I personally would pack something that mom and dad or the caregiver would also eat because I think at the end of the day that might go into one mouth or it might go into the other, and that's totally okay. You know, we mentioned earlier that like a source of protein is really important, that sometimes it's hard to see what that is. So I'm a big advocate for anyone traveling or any having long days, like just having a variety of sources of protein that are not going to be perishable and, you know, get them sick from a foodborne illness perspective. But being able to have those easy access sources of protein, easy access sources of carbohydrates to give them that energy to kind of get through the remainder of the day. I think that's important, right? And I think depending on how many appointments are, you know, going on, I think it's also valuable for those families to advocate for those, you know, nutritional needs too, to say like, hey, can we have a break for lunch? Some teams are good for that, some are not. So it really depends. But I think just having those easy access things and it is really important there.
Thank you. Yeah, Chef Kim, do you have something else?
I was just thinking actually I made a note about in your safe food handling slide. One of the most important things to wash, and that is melon on the outside, because melon carries E. coli. And that's a lot of times, even the slightest little bit of it and contamination is incredibly hard on the kids' bodies to recover from that.
Hmm.
That's one thing people don't ever seem to think, to
Never.
wash the melons on the outside, but that's kind of in the kitchen. We're constantly telling people that, and they're like, "What do you mean? We don't ever
Yeah, I'm
do
not
that."
going to eat the outside. Why do I have to wash it?
Yeah,
Exactly.
yeah.
Thank you. That's amazing. I never thought about that. So thank you for that input. And I don't know if we have more questions, but if not, I'm just gonna keep going. I just have a few extra slides. I know Hannah had to drop off, but that's okay. I love both of your presentation. Thank you again. As you leave this webinar, we would really appreciate you taking just 2 to 3 minutes to fill out a brief survey that will pop up on your screen as you try to leave. It's a great chance to tell us what are your thoughts of today's event, your feedback, but most important, what you want to learn or what you want to see in the future. Since this is one of our first events in ALL, this is our third one. So we're still coordinating, we're still planning things ahead. So I love to hear what are those things that you want to learn more. Next in September, we are planning to host an event about understanding my child leukemia's diagnosis. It's going to be like a supportive conversation for families and caregivers. Also in October, we're going to make sense of labs and genetic testings. We're going to make sense of what those numbers mean in ALL. And also, we're hosting in-person events, and I'm going to talk a little bit more about that in the next slide. So we're having this event called Connect to Cures, which is just an opportunity to connect with other blood cancer patients in your community. We're going to San Jose, Las Vegas, Austin, Brooklyn, Grand Rapids, Spokane. We've already been to other different amazing places, and it's just an opportunity for patients to connect with one another and hear from specialists in their community and community docs. It's really amazing. We have some lunch, and it's just a totally free event. I will be at San Jose and Las Vegas, so if you live near those places, I'll be happy to meet you. And if not, we can see in another event soon. You can save your spot to any of those events on the QR code, and I'll make sure to send those on the after email. And thank you to Amgen for sponsoring these events. If we didn't have them, we will miss this event. So thank you a lot. And before we wrap it up, I just want to say thank you to all of you from the bottom of my heart for being part of this webinars. I've added my email here, so please feel free to just message me or email me with any ideas or just to say hello.